How does pelvic inflammatory disease impact fertility? Pelvic inflammatory disease, often referred to as PID, can have a significant impact on a woman's fertility. To understand how this happens, we first need to know what PID is. It is an infection that affects the uterus, fallopian tubes, and other reproductive organs. This infection is usually caused by bacteria that ascend from the vagina or cervix, and it is often linked to sexually transmitted infections like chlamydia and gonorrhea. When PID occurs, it can lead to inflammation and the formation of scar tissue in the fallopian tubes. This scarring can block or distort these tubes, which are essential for the egg to travel from the ovary to the uterus. If the tubes are blocked, fertilization may not happen, or if it does, the fertilized egg may implant outside the uterus in a condition known as an ectopic pregnancy. This situation is serious and requires immediate medical attention. The risk of infertility increases with the severity of the damage to the fallopian tubes and the number of PID episodes a woman experiences. Research indicates that after one episode of PID, about 12% of women may face infertility due to blocked tubes. This risk rises to over 1/3 after 2 episodes and can reach up to 75% after 3 episodes. Overall, studies suggest that between 10 to 18% of women with a history of PID will experience infertility. In addition to affecting fertility, PID can also cause chronic pelvic pain and increase the risk of ectopic pregnancy. Therefore, early diagnosis and treatment of PID are crucial. Women who experience symptoms such as pelvic pain, abnormal vaginal discharge, fever, or pain during intercourse, especially those with a history of sexually transmitted infections, should seek medical evaluation promptly. From the perspective of fertility and endometriosis, it is important to note that while PID primarily causes infertility through infection and scarring, endometriosis can also contribute to pelvic inflammation and scarring, but through different mechanisms. Both conditions can coexist and complicate fertility challenges by affecting the anatomy and function of the pelvis. Effectively managing PID and monitoring reproductive health are essential steps in supporting fertility, particularly for women who also have endometriosis. In summary, PID impacts fertility by damaging reproductive organs, particularly the fallopian tubes, which leads to increased risks of infertility and ectopic pregnancy. Timely treatment and awareness of symptoms are key to minimizing long-term reproductive harm. Always consult healthcare professionals for personalized medical advice and treatment options.